Good afternoon and welcome to another edition of County Chatter. I'm your host today, Helen Chatel, and with me is Wendy Judd. Would you like to introduce yourself to the folks at home?
Sure, Helen. My name is Wendy Judd, and I am the public health nurse for Barnstable County Department of Health and Environment. We have a team of nurses that are full-time on staff, as well as those that go out into the community with wellness programs.
Excellent. So could you tell us by explaining the mission and purpose of Barnstable County Public Health Nurses and the role in the community?
Sure. Our mission is basically threefold: to promote public wellness, to prevent disease and illness, and to reduce health risks within the community through the programs and services that we bring out to the community.
Awesome. The Ask a Public Health Nurse program offers various health services. Can you provide more detail about the program's objectives and services it provides?
Yes, our Ask a Public Health Nurse program is a program in which we bring preventative services out into the community in conjunction with a registered nurse who they can sit and ask questions to and maybe have a consultation about some medical concern of theirs. So our preventative services that we offer are blood pressure and glucose for hypertension and diabetes to help prevent that, cholesterol screening and to help prevent strokes and heart disease, bone density screening to prevent osteoporosis, and we do tick prevention and skin and sun safety awareness. We offer those programs in a variety of different locations across Cape Cod. They include the Harwich Family Pantry, the Councils on Aging, community centers, as well as schools. So we do try to cross the gamut of where we offer those opportunities to the public in general. We tend to hit a lot of areas where there's a vulnerable population with the older adults. But we do also offer it to municipalities so that town employees can take advantage of those screenings as well. So it's a twofold approach.
That's great, especially, with busy lives, somebody might not often be checking their levels or vitals, and blood pressure is a huge thing, as well as checking for, being aware about ticks and other invasive critters that are out there that can cause disease. Mm-hmm. And then, of course, the sun, when it does shine here on the Cape, can certainly be a concern.
Yes, it's all providing education to the public in multiple languages is always something that we strive to do.
Perfect. How does the collaboration with Lower Cape Outreach Council's Food to Encourage program benefit the community, especially in terms of health screenings and counseling?
The Lower Cape Outreach Council has 8 pantries that serve the Lower Cape. And once a month when they have food distribution, our nurses, our Ask a Public Health Nurse program joins them. So it allows those individuals that are picking up their food to have a chance to sit with a nurse and get a blood pressure and a glucose screening, which is really a perfect time for them to check in on how they're doing with their health. Such as you mentioned before, they might not do it on their own. They might not have the equipment, they might be afraid, but sometimes just having that human touch of speaking with somebody at that time to check in, and it sort of gives them a little bit more control over their possible illness or something that they're trying to prevent. And while they're picking up their food, perhaps it's items that they don't know how to cook a healthy meal with, and they can sit with the nurses and receive some dietary instructions as well. So wherever the public health nurses are, there's always literature on diet, exercise, and preventative measures that they can take.
That's great. That's something my grandmother could have used. She was diabetic. She lived on cheese and cigarettes and coffee. So, and unfortunately, didn't go well for her, but I can see where that's really important as you get older, or any age in life, right?
Who doesn't love a good recipe too?
Right.
Somebody gives you have a good bag of food and you need something to do with it.
Something different is always good. Yeah.
Different and
absolutely.
Healthy.
The Vaccines for Children program is a crucial initiative. Can you explain its eligibility criteria and its impact on ensuring children receive required vaccinations?
Yes, our Vaccines for Children program, called VFC, is a federally funded program that allows us as a provider to provide all childhood immunizations to children that are eligible that would maybe not receive it otherwise, and it's of no cost to them. So the eligibility can be any of the following. You have to be 18 and younger, underinsured, uninsured, Mass Health, American Indian, or Alaskan. And we receive these vaccines from the state, and the schools send children over to us that are delinquent with vaccines, and we are able to provide it to them then, as well as we have a large population that comes in. They're from other countries, and they might bring their records in their native language. We then translate those records to see what vaccines those children have had and make sure that they've received them at the right intervals. Some come to us and they have had no vaccines at all, and we have to start them on a scheduled program as if they're a newborn.
Right.
And children need essentially 6 vaccines to go to school. But those 6 vaccines have to be spaced out at the right time to develop the proper immunity. And that takes a solid 6 months to schedule all of those out. There's
Right.
a couple more when they're older in high school, but this is just your basic. And if a school knows that that child is enrolled in a program with us where we're setting up the appointments, we're giving the vaccines, scheduling the next one, they can see our records, then that child is allowed to go to school because they're building immunity. And one of the services that we provide is we enter all of the vaccines that we provide to the child in what is known as the Massachusetts Immunization Information System, also known as MIIS.
Right.
And that is an electronic document that any provider in Massachusetts that sees that child in the future can see what vaccines that child has had. No matter where that child goes, it would be the same for you if you came as
Right.
well. And it's really important because a lot of these kids are so transient. They go to different schools, they live in different places, but this is one place where all of their records are combined. So it's really important to us to get our hands on old records as well, to consolidate it, put it all together as a service to that child. It's really crucial.
That's fantastic.
Yeah.
I know when I graduated high school, I got a little passport kind of thing from my school with all my vaccination records because I went to school in New York. So I had to get a booster for measles because at the time that was a huge concern. So having access electronically, which unfortunately was not available at the
Right.
time when I was going to school, but I think that's a great, for everybody because families do move and, I'm sure my 23-year-old has no idea what his vaccinations are.
Nope.
He doesn't pay attention to this stuff, but if they can access it online, then they have a record and be like, oh no, you don't need your tetanus, but you do need, a booster for this. And that's so important these days when you have so many other things going on and people not paying attention to their medical records.
I know it. And sometimes kids come back to us because they're going to college and they need records because they have to prove their vaccines, and we can give a printout for camps and schools and for college, so that record it makes it so easy that it's almost a disservice not to do it.
Right.
So we really work hard at translating records and getting them into the system. So
And that's
that
great for
child-
parents instead of having to fish around and pull out papers out of the junk drawer and maybe have it or get a hold of the doctor's office, which is always busy. They don't have time to take your phone call sometimes.
I know,
So
it
it's
is.
I haven't been a parent, I know.
Yeah, and I think as the public health nurse for the county of all 15 towns, this is my goal. I want to be able to consolidate all these records and provide this service because it's just the right thing to do.
Absolutely.
Yeah.
That's great. I'm so glad to hear about this program. It sounds wonderful.
Thanks.
Switching from that, tell us about your rabies vaccine initiative and who are the primary beneficiaries of this service and how can organizations request it?
So our rabies initiative we offer rabies vaccines. Pre-exposure prophylaxis, which is for somebody that has never had the vaccine before that might be at risk for it. And it is a 2-dose series, and they're a week apart. If somebody's had the vaccine before, then all they need is a booster. So what I was finding in our clinic was that individuals were signing up from multiple organizations, International Fund for Animal Welfare, animal control officers, veterinarians, sort of randomly here and there. And I thought to myself, there's a need. They're coming from all organizations. Maybe we can bring the vaccines to them. So I made a reach out into the community to the veterinarians and wild care, and I thought to say, do you have a need and can we bring this to you? Well, the response was quite good. So now our program is that we are bringing the rabies vaccine out to their facility. For instance, someone will call us or email us, and they'll let us know they're interested. They let us know how many staff they have to vaccinate. And we set up a time, like a Monday and a Monday, something like that. We tell them what the cost will be, and then we order the vaccines and buy them up front. We arrive at the clinic, we vaccinate the staff, we come back a week later, finish it up. They usually the office manager writes a check to cover it for everyone, and then we just redeposit that back into our vaccine fund to then be used on the same thing, kind of like a full circle. And we went to Bourne about a month ago, and 2 of the veterinarians were in surgery working on an emergency case, and in between cases they were able to come out into our area where we had set up to get their vaccines. And they were so appreciative, as you can imagine, just because it was so convenient and so necessary. And who could leave a work day to go and get that done? So now the staff is vaccinated. Now when the immunity begins to wane in about 2 to 3 years, that all you have to do is just make that call, and we'll come back and we'll give the boosters again. So it's been very popular. We're set up to do a few more veterinarian clinics as well as wild care. And that was just the initial reach out, because I saw people coming in dribs and drabs, and I thought, okay, there's a need. Let's go to the need.
That's great. Are you the only county doing it in Massachusetts? Do you know?
I have no idea. Good question. I can find out for you.
I just, it just seems like, there is such a need, and I can see needing it in other areas as well,
Well, we're keeping it Cape-wide because we're the Barnstable County, so our 15 towns, that's where we're keeping it. And so we also offer travel vaccines, and we are a CDC certified travel vaccine clinic, that if somebody were traveling outside of the country and needed a vaccine, they could, if they looked on the internet and looked up travel vaccines, Barnstable County's right up at the top. Because we're a B, probably at the beginning, but it's great. So they could call on us, and they consult with us over the phone, where they tell us where they're going, what country, how long they'll be there, how deep in the country they're going, and what elevation they might be going to, because certain, over 7,500 feet, mosquitoes aren't up there, so you might not have that. And who would think? But that's one of the issues as well. So we consult with them and tell them what are the recommended vaccines, what are the required vaccines. Again, schedule an appointment. We do appointments for all vaccines on Tuesdays and Thursdays by appointment. They simply schedule, come in, they pay for the vaccine, and we give them whatever documentation that they need to go on. And I can't tell you how many times people come in and they say, "This is the best kept secret." Well, it's not really a secret.
You heard it here.
And we do the rabies vaccine. We were always giving it mostly for travel, anyways, for people going to maybe like Peru or Ecuador, where there could be wild dogs or something. So.
Yeah, I didn't even think of that.
Less people would come for that, but there was a real need for people coming for the pre-exposure. Yeah, so that's why the initiative developed.
That's fantastic.
Yeah,
I'm learning so much today. Can you elaborate on the importance of tuberculosis skin testing in various groups that benefit from this service?
Yes. So tuberculosis skin testing, also called TB testing, is one of the programs that we offer. It is a 2-part series where you come in on a Tuesday and we inject a little bit of tuberculin under the forearm, and then 2 days later you come back and we feel it and read it and see if it's positive or negative, depending on if there's a lump and how big it is. And that might tell that you've had an exposure to tuberculosis. If that is the case, then our protocol is to have you follow through with a consultation to the infectious disease specialists in Hyannis, and we arrange that consult for them. And so that when the infectious disease calls the families, it's by somebody that speaks their language, and they arrange for the consultation, which would provide possible blood work or a chest x-ray to see if it is a possible case of latent or dormant tuberculosis,
Okay.
which would be easy to treat with medication. Now, latent tuberculosis is not infectious, but it can lay dormant in somebody's system for years, and it can become active. It just can do it. And if it is that time in which it would become a risk for the community and the population, and it's much harder to treat when it is active. So that's why we do the TB testing that we do. Some countries provide a BCG vaccine to their newborns because tuberculosis is endemic where they live. So sometimes those people that come to us and get that test done, they show up as positive because their body reads it as an exposure to tuberculosis. But the skin test can't determine that. So for the safety of everyone in the community, you need to treat each case as, if this test's positive, you need to go through this protocol just to be safe. So the people that need that test are children coming from other countries, immigration folks that come through, that are seeking to get vaccines with us,
Right.
because we also provide vaccines for them. The firefighters need it, and the students going to the college, the nursing schools, and the CNA programs. So we're quite busy with that every Tuesday and
I
Thursday.
bet. Nurses too, right?
Yeah.
When they first start, or
Nursing, yeah,
or
usually
every
in
so many
school,
years or something.
In schools, they do a nursing, at the beginning of nursing school. They
Gotcha.
do that, yes.
I thought I ran into somebody who had to have that test.
Yes.
Because she was working in a nursing home, so.
Yeah, and then they'll periodically test you again just to sort of see, have you, do you have a reaction? Have you been exposed?
Right.
But
Yeah, I mean, it's good to know if you've been exposed. Because then you can be treated, or, know that it's nothing to worry about. But
yeah, so it's medical treatment, that it's antibiotics and different medications that you would take over a period of time. But it's certainly better than becoming active TB, which could be life-threatening.
right, I think Walton's covered that when I was a kid. It was awful.
Oh no, was it John Boy?
No, I think it was the grandmother.
Oh,
or something.
no.
Yeah, I know. I watched way too much TV as a kid.
If I know the Waltons at least.
So, the public health outreach program involves a wide range of activities. Could you share some examples of how these activities contribute to the community health?
Sure. Our public health outreach program is really multifaceted. We get out there. So we do bloodborne pathogen training and infection prevention training for long-term care facility workers. We do bladder cancer screening for the fire departments, where we go to them, and it is a simple urine test, and that is something that will, because firefighters are at a higher risk for bladder cancer due to the nature of their work and the exposures
Right.
that they have. This is a simple test that will tell if there is an elevation in a particular protein in their urine, and if it is, then we tell them they need to follow up with their urologist, because it could also identify any underlying health issues that you might have that could contribute to that. It's a very early screening test, but it can be, if it's detected early, there's a 95% chance of a good prognosis of beating it completely.
That's great.
It is great, yeah. So that's a pretty easy test to do. We'll be doing that on the Lower Cape, and several towns just asked for it again yesterday. Yeah, it's a yearly test that they do. We do career fairs, and we collaborate with Capabilities Farm and the fire departments arranging for, and the school's nurses, where we call it Touch a Truck. And we'll show up at the fire department, and Capabilities comes and they bring food and for the families from the farms, and the schools tell us what vaccines the kids need. And the families come in, they bring their kids, they get vaccines, they're able to climb in the fire truck, get some coloring books, and then they go home with a bag of fresh food to go home. So it's a nice way to pull things together, get the kids vaccinated, meet the food insecurity, and make it fun for everybody.
That's great. So they're not afraid to get the vaccine because there's all this good stuff going on that it's just like...
Yeah, you can't go on the fire truck till the end. You got to get your vaccines first.
Exactly. It's just like you don't get dessert until you eat everything else, right?
Oh, another thing that we're just starting to do is partner with the Fishermen's Partnership. And we'll be going over to the Massachusetts Lobstermen's Association health fair that they're having, and providing tetanus vaccines for the fishermen that are coming into that health fair because they are at high risk. And many times they're out on the water and they don't get in, and they get fish hooks and injuries, and we're able to vaccinate them there at that time, which is exciting to connect with the people that are bringing the fish to our community, taking care of those that are tending to the animals in our community, which is great. And there are so many wellness fairs right now that are happening in the towns across Cape Cod that we are participating in. And it feels like every one we do, it grows bigger because one town is talking to another. And it isn't just organizations within their town, it's countywide. So it's really crossing the lines of shared services and across the border. So it's really exciting to see this post-COVID initiative of people getting together for events.
And you guys seem to be out in the community just meeting everybody.
We're trying to.
That's great. That's great. What role does the Cape Cod Medical Reserve Corps play in initiatives, and how do volunteers assist in various healthcare and emergency roles?
So our Medical Reserve Corps, MRC, falls under the umbrella of Department of Health and Environment. And they're all volunteers. They could be medical, non-medical, behavioral health, clergy. Just you can sign up, get screened, and you can join. And they support our emergency preparedness group at the emergency shelters. When there's a storm, they staff that. They provide Narcan training in the community. They provide family and friends hands-only CPR training in the community. They assist us in COVID and flu health fairs that we have. They do a really neat training, which was one of my favorites, was the Stop the Bleed training, which they teach you how to make a tourniquet out of something that might be in your beach bag, if that were to happen, if somebody were to have a shark bite, and what to do with that kit. So you'd be on a beach and somebody opens up the Stop the Bleed kit, and what do you do with it? So it's really cool. So we collaborate with them at almost every health fair that we go to.
That's great.
And they can be called on by anyone in the community to come out to their town and provide training. Today I was speaking with Wellfleet, and they just happened to mention that someone wanted AED training and a refresher course to use the automatic external defibrillator and some first aid training. And I said, well, I have just the people for you because the MRC does this. So a simple connection in a conversation, now the MRC can go to that town and provide those town employees that need a refresher to do, where's your AED, where's it located, how do you use it? If you don't use it, you lose it, you forget what to do. And first aid, so it's that sort of marrying up the right resources with the right people.
That's fantastic. That's great. Tell us more about the resource coordinators and their responsibilities, particularly in case investigations and addressing social isolation.
Okay. So our resource coordinators were originally the contact tracers hired during COVID, and in the towns that we covered for COVID, anybody that tested positive, our resource coordinators would contact them by phone to go over our isolation, quarantine precautions, and to see if they needed any supplies, or do they have food, because they were alone. And while they still monitor the COVID cases across Cape Cod, the Massachusetts Department of Public Health has shifted gears and moved them more towards case investigation of reportable diseases, such as foodborne illnesses, like salmonella, for example, and following through with those cases, and tick-borne diseases. And they work very closely with our contracted epidemiologist, Leah Hamner. So we'll do that for any town that needs assistance with that, if they just give us a call. And one of the things, Helen, during COVID that came from it was the social isolation. It especially hit Barnstable County older adults very hard. So the resource coordinators have collaborated with the Dennis Center for Active Living, and they offer a PEARLS program, and another acronym for you, PEARLS, Program to Encourage Active and Rewarding Lives. But it's for those individuals that have been identified as being isolated and at risk for depression, they're linked up with one of our resource coordinators who are trained to work one-on-one with them, either in their home or in the community center, to get them engaged in activities again, because they've been so isolated, they don't know how to get out anymore. And so if they go to their home, they might help them problem solve, troubleshoot. So, okay, how do we get to the next step? How can we get you to go do this? Right. And so it's sort of, they get them through that stumbling block, and it's a really nice service that they provide, the Pearls program.
That's great. I know a number of people who, during COVID, just like shut themselves away, and you know, it's hard for them to acclimate and come out again.
It is.
So I think that's really important that there's a service here on the Cape that can help that.
And it's sometimes not easy to get them to come out. You go to their home and you're good, and then they make an excuse not to go out. But you know, you keep at it, or then they get a little support group. If you can get them into the other building, then they might meet somebody else. Then it's just like little steps, but it's a good program. And they also are involved in the Buried in Treasures classes, the workshops that you had discussed with Erica a few weeks back. And they run those workshops, those 16-week workshops for those with the hoarding disorder. And they are based on a workbook, and they're about 10 people per class. They try to limit it to that. And they're actively going on in 3 towns on the Cape right now, with more lined up to go after this. And they help people to work week by week in the process of, why are you collecting? How do we start to identify reasons? How do we part with something? It's like just step by step, but it turns into a nice support group, and it's been very successful.
That's fantastic.
Yeah, it is.
I was talking about it to some of my friends about what Erica was mentioning about, and they were so happy to hear that it was coming back and people are getting back in person, because they find it's a valuable resource here on the Cape.
It is, so. And we have classes lined up. Towns want repeat classes already. We say, well, we've got to make sure all the towns can get hit, and we're happy to come back and do more. Right. So which is really good. And one of the things that the MRC is again working with us on now, this is a new initiative, is that they are being trained as coaches for the hoarding disorder, the Buried in Treasures classes, so that when someone is starting to get towards the end of the class and has to go back home to their belongings, their treasures, the coaches will be working with them one-on-one for a period of time. They'll meet them during the actual classes, so they develop a relationship, and a trusting relationship. And then when they go into the homes, that person can be with them to help them use the tools that they learned in the class to get them through the process, so they're not just done with the class and then you're done. So there'll be a time frame to work with them, and it's a wonderful thing for the volunteers to be able to do.
That's great. It's great that there's follow through and, a coach there. It's so important in so many other things. Everybody needs a little assistance every once in a while, and to just have somebody cheering you on, I think is very important in life.
It is. And it was heartwarming to hear to see the volunteers. There was such an outreach where they see the need and want to help and volunteer to do it. Yeah.
No, that's great. And one final thing, on your webpage, you have a helpline the public can call. Can you share with us how this is managed?
Yes. So our helpline was originally the COVID line. It was put into place during COVID for people to call for COVID support. But people aren't really calling for that so much anymore. So we have transitioned that into a line that is managed by the resource coordinators. If someone calls and leaves a voicemail, they get back to them within 24 hours. And it is more of a resource line. So if someone needed to find a hoarding class, they would call that line, and we could tell them when the hoarding class was. But we have developed a care guide, and CARE stands for Community Access to Resources and Education. And it is a care guide online that is county-wide services in a variety of areas: transportation, elder services, food access, infectious diseases. There's so many of them that if someone has a need, they can call, and the resource coordinators will call them back and help them identify what is local in their area that are services that they can have access to. Because we know the services are out there. We know the resources are out there. We know the people are out there that need it. It's helping them connect, and sometimes people don't know where to look. So as the county, we want to try to help share those resources, and that helpline can be one way to do it.
That's fantastic.
Yeah.
Well, this is all the time we have today. I'm sure we could talk for hours about other things. But I want to thank you, Wendy, for coming on to the show.
Thank
Do
you.
you have anything else you would like to say to the public?
The Department of Health and Environment is really the safety net for the 15 towns of Barnstable County. We serve the vulnerable, the most at-risk, the children, the municipalities, as well as the professionals. If a town needs assistance providing services or programs or meeting the needs of its residents, it simply has to reach out to the county, and we are more than happy to bring the services to their town.
Excellent. Well, thank you today for coming in, and I'm your host, Helen Chatel, and this concludes this episode of County Chatter. We'll see you next time.